OBGYN cancers can reach all women. Women who are incredibly attuned with their bodies and women who are ignoring and avoiding their health.
I wish I knew about these symptoms 10 months ago, 12 months ago, a year. A year ago, I really did. I really do wish that I knew this and had this information. If I knew this, I might not be sitting.
What I think every woman should know, young or old, is I would want them to really understand their bodies, know their anatomy, know how things work normally. So when things are abnormal, they can recognize that early. And if something's different and not right, ask questions and get answers. That's what your doctor is there for. And not even just your doctor, but mom, aunt, sister, community. That's the thing we're trying to encourage.
We don't have the diagnostic tests that we need to have for some of these women's cancers. And I want everyone to understand that when you go to the doctor, you're not being tested for everything. You may think you are, but you're not. And that's something that every woman needs to know and take personal responsibility in, and not to ignore her body.
For me personally, I was really in shock because I was feeling good. And I shouldn't say I was feeling good. I had stomach discomfort and bloating and symptoms. I didn't know what those symptoms were.
You know, do you talk about ovaries, you know, in public kind of thing, you know?
Oh, okay. For ovarian cancer, the problem is that the symptoms of ovarian cancer are the same as symptoms of a lot of other things that we see that are much less serious. So what occurs is that women will go to their doctor with some of these symptoms, and the majority of the time their doctor initially tells them it probably is associated with something much less serious.
It actually took a year from the start of my symptoms to the day I was diagnosed to discover my cancer.
Abnormal bleeding, stomach cramps, bloating, weight gain, weight loss, anything that can be confused with everyday symptoms.
The mass was bigger than a basketball that they found inside my stomach, on my ovaries. I'm fighting. And I've been fighting since I found out about it, since 2009.
When we catch ovarian cancer early, it's usually because we're lucky or because someone has a lot of pain related to a big mass that's confined to an ovary that prompts evaluation. If something doesn't feel right, ask why.
I dismissed a lot of things, blowing it off, thinking I was either coming down with the flu or just gaining weight, when in retrospect what I know now was actually signs of ovarian cancer. You gotta listen to your body, and my body was screaming, it wasn't whispering, and I kept dismissing things.
So every woman should try as hard as she can. Find out if anyone in her family has had not only ovarian cancer, but breast cancer also. Both those things really increase a woman's risk of developing ovarian cancer, and she may be appropriate to be screened for a genetic predisposition. And that is the most powerful thing that we have to identify those women who should undergo risk reduction surgery, for instance, or even take prophylactic medicines such as birth control to lower risk.
Patients that have been on the birth control pill for approximately 2 years can decrease their risk of developing ovarian cancer by up to 50% in the future.
Women who have the breast cancer gene, BRCA1 or BRCA2, are not only at risk for breast cancer, but it increases their lifetime risk to between 20 and 35% of developing ovarian cancer. So these women really do need counseling. They may have choices that they can make to reduce that risk significantly. And seeing a specialist like a GYN oncologist to have that conversation is very important.
Every woman needs to know that it doesn't affect just old women. It affects young women. 34 when I was diagnosed, no idea, just going through life, trying to live it and do things, and all of a sudden it hits you. And
what kind of cancer?
Ovarian, stage 3C. And yeah, it affects more women than you know, and I think more women need to talk about it. The best thing is to see a GYN oncologist and get them to do your surgery and do your treatment, because they're the best.
What I urge women to know, younger women, all women, is basically to trust your body, listen to your body, and when something feels like it's different or not right, then don't be ashamed or afraid to go and find out what's going on and ask somebody to evaluate you. Don't assume that something is normal that is a change from your baseline.
I think that women should know they should be proactive about their health, have their checkups with their breast, pelvic, and pap exams, and if they have any unusual symptoms, they should ask their doctors for an ultrasound. And if they have a family history, they should ask for genetic testing.
Es uno que debe de pedir, es uno lo que uno debe de controlarse, de decir, doctor, ¿qué es lo que me está pasando? Doctor, quisiera saber cómo están mis ovarios. Por favor, hágame una orden de un sonograma, una colonoscopía más extensa o un casting. Hay que darse el tiempo para ir al médico.
Symptoms of cervical cancer are abnormal bleeding, typically during intercourse, abnormal pap smears.
Well, I'm a labor and delivery nurse. I would just say get a pap smear. Get your pap smears. Get a pap smear.
It is amazing how many advanced cervix cancers can be prevented by just going in and having your pap smears done. I can't stress this enough.
New guidelines have just been published in terms of cervical cancer screening, which suggests that we now start our pap smear screening no earlier than age 21. Also, they initiated the new HPV co-testing with pap smears, which after the age of 30 typically allows us to be able to space out pap smears and cervical cancer screening to every 5 years as opposed to every 3 years with pap smears alone.
In Latin American culture, we usually don't go to the OBGYN until you're pregnant or until you really need to go, like there's something wrong with your body. So I went to get the exam, and it was really quick and it was not painful at all. And I'm really glad I did, because once you get your exams and you see that you're okay, it's a big relief that just lifts up your body, so it's really important.
It's estimated in the United States that half of women who get cervical cancer in the United States have never had a pap smear in their entire life, and another 20% haven't had a pap smear in the last 5 years or within screening guidelines.
Yo le dije para el año siguiente, y el año siguiente ya marcó una gran diferencia, un sufrir extra que me gané por decir, me lo hago el año siguiente.
Young women, particularly women in their teens, need to think strongly about the use of the HPV vaccine, which has the potential to eventually eliminate cervical cancer in the United States. In contrast, older women, for the most part, need to be simply more aware of their bodies. They need to be concerned with changes in the way they perceive their body, changes in things like appetite and bowel movements, or bleeding. Irregular bleeding from the vagina is probably the single most common symptom associated with the cancers that we deal with.
We know that most cervical cancers are associated with the human papillomavirus infection. So if we can prevent that infection by vaccinating patients early, then we are able to help prevent the development, hopefully, of a potential cancer in the future.
And in most women, that's just an infection that you live with. You have no symptoms. You don't even know it exists. But in some viruses, they have a predisposition to actually change those women's cells forever. And because it's silent, until cancer is developed, there are no symptoms. Even early cancer often doesn't have symptoms. The only way to know that the virus is there and doing this is with a pap smear. And that's why pap smears are so incredibly important.
I told my mom and my sister that they should go get a pap smear, and they're gonna go get it, so I'm really happy I told them about it.
What I would like every woman to know about endometrial cancers is that it's actually one of the most common women's cancers that we know in the female genital tract. However, it's also one of the most curable.
I'm a uterine cancer survivor of 17 years. I've had 5 recurrences, and what I want every woman to know is don't ever give up.
Uterine cancer is also known as endometrial cancer by a lot of people, and this cancer is usually a disease of older women, that is, women beyond the age of menopause. Most of the time, the symptoms of this are vaginal bleeding that a patient hasn't had in a number of years. The woman who has this needs to get that investigated at all costs. We know that vaginal bleeding after the age of menopause is virtually always associated with some pathology.
If you have bleeding, you know,
I had
afterwards,
some spotting bleeding. I had some discharges that were clear and burnt orange color and several a day. And then I had some mild pain down in my right side and lower pelvic area.
It's about 5% of women who get uterine cancer are premenopausal, and we do see cases in women in their 20s and 30s. Some of them are associated with rare genetic risks, but those are pretty uncommon. Obesity is the #1 risk factor for developing uterine cancer, and obesity is prevalent in women under the age of 50. So women who don't ovulate regularly, meaning they don't have regular menstrual periods, they go months without a period, then have very heavy periods, or they have more than 1 period per month, those are warning signs, particularly in heavier women, that she might be at risk for developing uterine cancer.
If you're going through that perimenopausal period and you're having strange bleeding, go get checked out. Maybe it's just another period hanging on, maybe it's not. And those are the kind of things that can really save lives.
What I want women to know is that if something doesn't feel right with their bodies for 2 weeks or longer, I want them to make an appointment and go to the doctor and demand that that doctor do the testing that they think is needed to figure out what is wrong with their bodies. They owe it to themselves and they owe it to their friends and family.
No one's comfortable talking about their vagina. No one's, talk about your vagina, no one's comfortable doing that. Talk about an itchy vagina? Hell no. No one wants to say I have an itch in my vagina, So yeah, I think that you also have to be willing to let your guard down and realize, okay, there's something funny about talking about women's private parts,
Vaginal cancer is one of the rarest forms of gynecologic cancers. However, it is also very important to know the warning signs and symptoms. A simple visit to a physician or the pap smear at that visit, or at least a physical examination to inspect the area, may be enough to detect a lesion that can be then biopsied and then lead to the correct treatment. So it's very important to get it checked out if you have irregular bleeding, pain in the vaginal area, bleeding after intercourse, all potential signs or symptoms of vaginal cancer.
There's nothing to be ashamed about looking down at your vagina or your vulva, asking for someone to check this out.
Vulvar cancer is an unusual one because it is typically a disease of very elderly women, typically women in their 70s or 80s. And it's a disease that has relatively few symptoms, or that the symptoms that they have are typically ignored. Older women typically are embarrassed a bit to talk about symptoms of the genital tract.
In terms of vulvar cancer, that little itch could be telling you something. It often presents with itching. If you have a persistent itch in your vagina or in your vulva, it's not a yeast infection and is not going away, you need to go for evaluation to see if there's anything there that could be a precancer or a cancer. You notice a mole, you can get melanomas and abnormal growths on your vagina and your vulva. You notice something that's new, a new change, it's worth getting evaluated for that.
It went from 2002 to 2012 for someone really knew what was going on with me. So I've been in pain for 10 years.
Don't be afraid to find out what's wrong, because if we can catch it early, we can cure it early. And you can go on and live a beautiful, happy, long life.
I had a 3-year-old and a 5.5-year-old when I was diagnosed. And so there's not a whole lot that they remember from before. So as long as I can continue to do the mommy things, they're happy.
In the beginning, when all of this first started,
I almost felt like I didn't have, like I wasn't allowed to say, oh, well, we'll do that, you know, like next year, because I didn't know if next year was going to be here. So now, I don't have to feel that way.